All right, here we are on our last segment of childhood nutrition. Um, we can talk about some of the behavioral changes, parent caregiver involvement, improve success. We've talked in the past, that families, they really need to incorporate a whole movement here. So not having special foods for one child, or having junk food in the house that overweight child may want, that the whole family should participate and be physically active and make these healthy choices together. There are some options for the use of medications for an older child that's overweight, or even surgery. And you have on table 1113 the selection criteria for surgery candidates. And it's mostly a very high BMI, and then other comorbidities like hypertension, diabetes, high cholesterol, asthma. Things that we can do to improve nutrition all around. Encouraging meal times at home. Well, right now in our COVID um, quarantine, it's pretty easy to eat more meals at home. Provide a variety of nutrient-dense foods, nurture their self-esteem, honor your children's preference, have them involved in the cooking process. Here, this is my Lucy and our neighbor Paige. They're helping us grind up venison. So they're part of that process. And then here in this picture is my 10-year-old Hattie, or Hattie when she was 10-year-old. She's 16 now. She planned this whole meal for us, wrote a grocery list, and then made the food and presented it for us. So just getting them involved in healthy cooking and preparing of the food can help. And then they explore different foods that they'd like to try. And she's sitting on the couch right now giving me the side eye because I'm talking about her, and she probably wants to see what this picture of her looks like. Last slide here, folks. Nutrition at school, or not at school right now, but we have the school breakfast program and the school lunch program, and you have on table 1118 that lunch pattern for the different ages. So these are the requirements under the Michelle Obama 2012 guidelines, that they need to get a certain amount of green leafy vegetables. They need a certain amount of protein, sodium, fruits, milk, and grain servings. And recall that there was some controversy with this. Many schools in affluent areas have rejected the use of these recommendations because they don't need to rely on subsidies, because they have very few students on free or reduced lunch. But many of the students in our area are on free and reduced lunch, and those schools do need that aid, so they're then mandated to follow those requirements. And then you have the competing influences at school, so trying to get soda machines, snack machines, vending machines, school stores, trying to have those closed down during regular meal times can help increase access to that healthy food. So there's our childhood nutrition lecture. I encourage you to look at the math packet for the information on figuring out calories for children. And the math here and the childhood nutrition is the most, I guess, robust, you could say. So you have to remember your rules of mathematics, where you're going to do the inside the parentheses first, and making sure that you're looking at the right age and the right sex of the child as well. And I will post a video doing a review of that math coming up here. Have a great day.